9 symptoms of suicide disease to look out for, from chronic pain to stiffness. A young woman's family has shared their heartbreak as she's been living with the suicide disease for more than 5 years. Amelia Martin, 23, from Canterbury, and her mother Natalie, 48, are trying to raise awareness of the condition. It has also recently come into the spotlight following the release of the Netflix documentary, Take Care of Maya. Suicide disease, which is formally known as Complex Regional Pain Syndrome, CRPS, causes such intense pain that sufferers may consider ending their lives. It is thought that the suicide disease occurs when small C-fibre nerves, which extend throughout the body and speak to the brain, get damaged. This confuses the nervous system, creating one of the most painful conditions in the world. In Australia, a young girl named Bella also suffers from the condition. The 10-year-old had first developed a blister on her foot whilst on holiday in Fiji. But when her foot started to swell up, it became clear that something else was going on. Bella is now mainly bedridden, occasionally using a wheelchair to get around after swelling and pain traveled up her leg. Here we explain what the suicide disease is and what its symptoms are. What causes the suicide disease? The chronic condition, officially known as Complex Regional Pain Syndrome, CRPS, is poorly understood. Most CRPS sufferers develop the condition after experiencing an injury, ranging from a small cut to fractured bones. Horrific pain then develops and spreads beyond the injury site, often to a whole limb. Because the condition produces different, complex symptoms for each patient, it is unlikely to have a single cause, according to the NHS. Some people may be genetically predisposed to CRPS, but it's thought that it is caused by body systems malfunctioning. What are the symptoms? The main symptom of CRPS is constant pain, which can be worsened by stress, changes in temperature and physical contact. Sufferers may also experience difficulty sleeping, osteoporosis and changes to their hair and nails, according to the NHS. Pain relief medications are rarely effective. If their daily life is significantly impacted by the disease, then psychological problems like anxiety, PTSD and depression may emerge. In addition to chronic pain, a range of other symptoms can appear. These can include strange sensations in the affected limb. It may feel as if it does not belong to the rest of your body, or it may feel bigger or smaller than the opposite unaffected limb. Alternating changes to your skin. Sometimes your skin in the affected limb may be hot, red and dry, whereas other times it may be cold, blue and sweaty. Changes to skin color may be harder to see on brown and black skin. Hair and nail changes. Your hair and nails in the affected limb may grow unusually slowly or quickly, and your nails may become brittle or grooved. Joint stiffness and swelling in the affected limb, edema. Tremors and muscle spasms, dystonia. Difficulty moving the affected body part. Difficulty sleeping, insomnia. Small patches of fragile bones, osteoporosis, in the affected limb, although there's no evidence this could lead to fractures. It is rare, but CRPS can also lead to further physical complications, including skin infections and open sores, ulcers. Muscle atrophy, where the muscles begin to waste away. Muscle contractures, where the muscles shorten and lose their normal range of movement. In some cases, those who suffer from CRPS may find their mobility is impacted. Who is affected? It is not known what makes someone more vulnerable to CRPS, and there's not a single test for it either. A variety of investigations are used to rule out similar chronic pain conditions. CRPS is thought to be uncommon, but it tends to present more often in women, particularly those under 40, than men. It is rare in the very young and very old.